Hi, my name is Molly, and I'm an occupational therapist. I understand that you've recently fractured your left wrist and have had surgery. Today I'll be showing you some activities you can perform at home now that you're in a removable orthosis. An orthosis is just another name for a brace.
Hi, Molly. My name's Shannon. Nice to meet you.
Shannon, are you right or left-handed?
I'm right-handed.
Since you injured your non-dominant left wrist, it's important that you use that hand for the activities I'm going to show you. Some of these activities may cause discomfort. If you feel any discomfort, you can always switch to using your non-injured side or using your injured side for support. You can also modify the activities such as changing your grip or taking breaks.
So pain is bad, right?
Some of these activities may be uncomfortable and that is okay, but if anything is painful, I want you to discontinue that activity with your injured hand. You can always try the task another time. Also, you can try performing some of these activities with your orthosis off if it feels comfortable, but if it doesn't feel comfortable, I want you to put the orthosis back on.
Okay.
First, let's talk about eating with a knife and fork. You should avoid foods that are tough or hard, like steak and potatoes. Here's some chicken. Why don't you try to use both hands to eat the chicken as you normally do?
Okay. I usually try to hold the fork with my left hand and I cut with my right. That was a little bit challenging, but with a little effort in turning my hand, I could do it.
Great. You can eat and drink at home, as well as prepare small meals like making a sandwich.
That's great news. I didn't think I'd be able to use this hand for anything at home.
Next, let's talk about using your hand for getting dressed. Why don't you try putting on a shirt, buttoning the shirt, and then tying your shoes?
Oh, my husband tied my shoes for me today.
Some people injure their dominant side, and it's easier for them to use that hand because they're used to it. But since you injured your non-dominant side, it's important that you try to perform activities that require the use of both hands, like buttoning or tying your shoes.
Oh, I see what you mean. I could easily use my right hand for everything.
Mm-hmm. Great. Try to use both hands to button. Awesome. Let's try tying your shoes. Great job.
Great. I could do this at home on my own.
Now that we're in the bathroom, let's work on some grooming tasks. Here are some deodorant. Why don't you try putting this on with your orthosis off? You can gently move your wrist as you're putting the deodorant on.
Okay. Wow, this is a great activity to get your wrist moving again.
Right. Daily activity can be a great way to start mobilizing your wrist. Next, let's have you try to wash your face. Start with the soap and then gently use the washcloth to remove the soap.
Okay. But I don't want to wring this out with my left hand.
I agree. Instead, wring the washcloth out with your right hand and then use both hands to remove the soap.
Okay. It's a little difficult to do, to turn my hand over, but with a little effort I can do it.
Great. The last activity we're going to go over today is brushing your teeth. Since you're right-handed, you probably brush your teeth with that hand, but why don't you practice opening up the toothpaste and putting on the toothbrush with both hands?
Okay. I usually hold my toothbrush with my left and I put on my toothpaste with my right. That wasn't too hard.
Great. Continue to do this activity exactly how you would do it at home. Shannon, I'm giving you a handout of activities that you can perform at home. Try to do these activities to the best of your ability. Think about how you used your hand prior to your injury. The goal is to use your hand as much as possible. You can adapt or compensate if something's uncomfortable, but try to be as normal as you can. Again, if it is painful, switch hands and try the task another time. Also, it's very important that you follow the post-op instructions provided to you by your surgeon. Now that your post-op bandage has been removed, you can perform normal hand washing with soap and water. Don't be afraid to get your incision wet under running water. You want to clean it thoroughly. After any type of hand washing or showering, just pat the incision dry. Until the cut is healed and the scab is gone, keep it covered with clean dressing. There are 2 things we don't want you to do to your wound. Do not apply any ointments or lotions, and do not submerge your wound under water.
Oh, so I can't take a bath?
Well, you can take a bath, but when you do, don't soak the hand under the water. Also, because your fracture is not healed yet, it's important that you avoid any weight bearing to the injured side. That includes pushing out of the tub. Do not push, pull, lift, or grip anything heavy. You can pick something up the weight of a cell phone, but nothing heavier.
I understand what you mean. My hand's been swollen lately also. Is there anything I can do for that?
If you're experiencing swelling, you should try to keep your hand elevated. Also, it's important that you try to move your fingers to make a full fist and start gently moving your wrist. You also want to keep an eye out for any signs of infection and contact us immediately, although the chances of this are very low. If you experience any new redness, pain, or liquids coming out of your wound, contact your doctor immediately.
Okay.
Shannon, I want to give you my email address in case you had any questions. Why don't you go ahead and put my email into your cell phone with both hands? Try to use both hands as you normally do.
A little hard to reach the buttons, but I can do it.
Great. Continue to try to use your hand as much as possible. This video has demonstrated how to utilize the hand of your injured wrist if you fractured your non-dominant side. If you fractured your dominant side, please use your dominant hand to perform the activities on the handout and switch to your non-dominant side if you experience any pain while performing the activity. Remember, try to do the activities on the handout like you did prior to your injury.